What is causing black fungus in some COVID survivors?
बात बीमारी ब्लैक फंगस की
साथ साथ अब देश में ब्लैक फंगस बीमारी का भी कहर देखने को मिल रहा है। देश में ब्लैक फंगस के करीब 9,000 केस सामने आ चुके हैं और 126 लोगों की मौत हो चुकी है।
In comparison to the 20 cases per year in India generally, 8,848 active cases of black fungus have been reported at the moment. That's a whole 44,140% increase. 44140. Say that number to yourself. The mortality rate, meaning the number of people who die from black fungus, is more than 50%. And these are some very scary numbers. This left me with a couple of questions. First of all, why is a virus increasing the chance of a fungal infection? They aren't even in the same kingdom of a living being. 2. What can we do to be safe, especially considering that state governments of Rajasthan, Gujarat, and Telangana states have declared black fungus epidemics? And 3. What even is black fungus in the first place? And I have obviously done my research. Hi, I'm Ishrat, a medical student, and let me try my best to explain. First, let's try to define what black fungus really is. Black, which is a color, and fungi are any group of spore-producing organisms that feed on organic matter. Black fungus is also known as mucormycosis, previously known as zygomycosis, which in all honesty sound like names of Pokemon. Pokeball, go! Jokes aside, mucormycosis is an opportunistic fungal infection, meaning it occurs more often than not in people who are immunosuppressed, or in other words, it uses weak immune systems as an opportunity to infect. It's caused by two main genuses of fungi, Mucor and Rhizopus. Some risk factors include leukemia, chronic kidney disease, transplant receivers, cancer patients, and those who are on immunosuppressants, a lot of which of these drugs are actually steroids. One of the most commonly prescribed drugs for moderate COVID is dexamethasone, which is a glucocorticoid. And what do glucocorticoids do? Well, one of their functions is to suppress your immune system, and this helps reduce COVID-related inflammation. This means if steroids are prescribed improperly or overused, it can make mucormycosis a potential risk. Unfortunately, this is the case in India. In the first wave of COVID last year, lung involvement wasn't as common as it is this year, prompting the use of steroids to provide temporary relief to patients. Sadly, this has made the opportunity of infection from mucormycosis to increase. Another important risk factor is diabetes. This is especially important in India as we have the second largest diabetic population, only after China. We have 77 million patients with diabetes as of 2019. 1 out of 6 people with diabetes lives in India. To understand why this happens, we need to understand how mucormycosis actually affects the body. Humans reproduce by having babies. Fungi, or in this case, Mucor or Rhizopus, reproduce asexually by making spores. Kind of like pollen, they transmit in the air and eventually end up in soil or vegetative matter where they grow. When spores enter the body of someone with a normal immune system, they get killed because of unfavorable conditions. However, when the spores are inhaled in someone who is at risk, the spores can start growing in the blood vessels. This is especially common in those with diabetes and diabetic ketoacidosis, where the blood is acidic due to the presence of high blood sugar and ketone bodies. In COVID and most other viral infections, blood sugar levels ramp up even higher than normal. This makes it favorable for spores to grow. When spores grow, the blood vessels become blocked, preventing tissues from getting the oxygen they need, causing ischemia and eventually pathological cell death, also known as necrosis, which isn't a good thing. Now, there are actually 5 types of mucormycosis. There's rhinocerebral mucormycosis, which infects the sinuses and can spread to the brain. There's pulmonary, that affects the lungs. There's gastrointestinal, that affects the digestive system. There's cutaneous, that affects the skin. And there's disseminated, that spreads to the bloodstream. Black fungus generally refers to rhinocerebral mucormycosis. This occurs when the mucormycosis affects your nose and then travels through the cribriform plate. This plate has small holes that allow for one of the cranial nerves to enter the brain, specifically the frontal lobe. This gives the fungus an easy access to your brain, like an uninvited party guest. This eventually causes cell death, leading to something called frontal cortex abscess. This often mimics the symptoms of a stroke, causing paralysis, confusion, ataxia, also known as the inability to speak, and eventually death. Because once the fungal infection gets into your brain, there's nothing much you can do. It can also cause necrosis of the nasal cavity, sinuses, which are air spaces in your bones, the orbital region, along with the eye sometimes, and even your jaw, which is why you see those disturbing images of black discoloration of the eyelids, nose, and the mouth. When this happens, you need extensive facial reconstructive surgeries to remove the tissues. Sometimes this involves in removing entire parts, such as an eyeball, which, in all honesty, India as a country cannot afford to do on such a wide scale. And even those who can afford it have an awful recovery journey ahead of them. To make matters worse, antifungal medicine amphotericin B is in shortage at the moment. The good news is mucormycosis, or black fungus infections, are very rare in those who are healthy. But where we need to be careful is with patients who have diabetes, comorbidities, and those who are immunocompromised. This requires social distancing, staying at home, and wearing masks at all times when you're outside. It's also important to be vigilant of signs of nasal stuffiness, bleeding or black discharge, swelling near the eye, drooping of the eyelids, and changes in vision after COVID infection, as these are the early signs of mucormycosis, which can be treated without affecting the brain or requiring surgery. It also becomes the responsibility of our doctors and ourselves to understand, control, and monitor the use of steroids and manage our blood sugar levels accordingly. I hope this video helped you. Please stay safe and keep both physically and mentally healthy. I wish you a good day.